Manager of the Hospital Authority. First, Dr. Au will give you an update on cases. Friends of the media, members of the public, good afternoon. Today, I'm going to report the number of cases and the latest information as at the 10th of March. Yesterday, for PCR positive cases, 18,888. Case number 575,630 to 594,517. Of these 18,888 cases, 2,284 cases confirmed through the Hospital Authority, 2,513 cases are confirmed through the Public Health Laboratory Service. And for the remaining 14,091 cases, they're confirmed through private laboratories. And of these confirmed cases, 4 are imported cases. For the remaining 18,884 PCR positive cases, they are local cases. On DNA analysis, yesterday the Public Health Laboratory Service conducted data analysis on 2,513 specimens. No specimens were found to contain the L452R strain, and 1,704 specimens tested negative for L452R. That means they are Omicron cases. And for the remaining 809 cases, we're still doing an analysis, and in some specimens, there's not enough viral load. For rapid antigen test results, in the past 24 hours, or in the 20 hours since yesterday, there are 10,493 reported positive cases. And together with PCR cases, there are a total of 29,381 cases. Now, as I mentioned, 18,888 cases are PCR positive, and then 10,493 are RAT positive. In the cumulative total in the fifth wave is 634,169 confirmed cases. For residential care homes, yesterday, an additional 13 homes have seen either cases or outbreaks. There are 9 residential care homes for the elderly and 4 for the disabled. There are a total of 295 cases. 262 are home residents, and the remaining 33 are staff members. For the fifth wave, in total, 731 residential care homes for the elderly have seen cases. That's 91% of the total number of homes. And in the past 2 weeks, there are 410 homes with outbreaks. That's 51% of the total number of homes. For all RCHEs, there are a total of 23,400 residents who've been infected. That's 31% of the total number of residents. And 6,100 staff members have been infected. That's 20.64% of all staff members at these homes. And for residential care homes for the disabled, there are 253 homes that have seen infections or outbreaks. That's 75% of the total number of homes for the disabled. And in the past 2 weeks, there are 164 homes with outbreaks or infections. That accounts for 49% of all homes for the disabled. And there are about 6,380 residents infected. That's 35% of all the home residents. And then 2,350 staff members have been infected. That's about 22% of all the staff members at homes for the disabled. On death cases, there are now 1,893 death cases for involving home residents. 1,887 death cases involved homes for the elderly, and 6 cases involved homes for the disabled. For the latest death figures in the fifth wave, there are a total of 3,231 death cases. The death rate is 0.51%. and that's 1,813 males and 1,124 females. Age is between 11 months and 122 years old. The median age is 85. And there are still 5 cases of death involving children. And for the age group 18 to 59, the number of death cases is increased to 144. That's 4.46% of the total number of death cases. And most of the death cases involved those aged 60 or above, 3,078 cases in total, and that's 95.9% of all the death cases. And then 2,247 cases involve elderly aged 80 or above. That's 69.5% of all the death cases. On vaccination, the latest analysis of the Center for Health Protection is that among the death cases, 90.7% of the disease have not been vaccinated or have not completed vaccination. And those aged 80 or above that are deceased, the 92.5% of them were not vaccinated or have not completed vaccination. And for all death cases, the fatality rate is 1.84% for those who have not been vaccinated or who have not completed vaccination. And compared to those who've had 2 doses of vaccine, the fatality rate is only 0.07%. So that's 26 times of difference. For elderly aged 80 or above who have not been vaccinated or have not completed vaccination, the fatality rate is 11.7%. Compared to elderly aged 80 or above who've had 2 doses of vaccine, the fatality rate is 2.55%, so the difference is 5 times. Dr. Sarah Ho will give you an update on hospital authority cases. There are 9,760 confirmed cases in prelim positive cases staying at public hospitals: North Lantau Hospital, Hong Kong Infection Control Center, Hospital Authority Infectious Disease Center, and the AWE Community Treatments Facility. Last night, we reported 79 patients in critical condition, 122 patients in serious condition, 76 critical patients are now in ICUs. As at 0 hours today, in the past 24 hours, a total of 196 patients who tested positive for COVID-19 passed away. 127 males and 69 females, age between 24 and 107 years old. Among the patients who passed away yesterday, 113 came from residential care homes. 148 of the deceased did not have any record of vaccination. 30 of the deceased had 1 dose, 12 had 2 doses, and 1 had 1 dose, 3 doses. 185 of the deceased are elderly aged 65 or above. And then there are a few relatively younger persons who passed away. One is a 24-year-old male. He has some genetic disease. He lived in a home. He vomited once, and then he had seizures, and then he tested positive at the accident and emergency department, and then his condition deteriorated rapidly. On the 10th of March, he passed away. There's another 50-year-old female, and then a 52-year-old male, 57-year-old male, 58-year-old male, and 59-year-old male. For these 5 persons who passed away, they all lived in homes. So many of them had chronic diseases, or they were bedridden and they required constant care. And one required renal dialysis. So and then there is a backlog of some figures that we have to report today. Between the 28th of February